the United States. What leads you to believe that? Because, for example, there's been many people that are sick this year, maybe more than normal, and it wasn't the flu. So how are you certain that that wasn't related to this, and that mild symptoms that aren't being counted in that denominator of the numbers that you have there?
So thank you for that, and I will clarify. You are right. I know that there are likely cases in the state of Michigan right now that I do not know about, which is why I'm emphasizing these community mitigation measures. Based on the testing that we've done thus far, I do not see evidence of there being broad community spread. So we ran a whole set of samples yesterday. They were all negative. I'm assuming those patients had symptoms and they were appropriate to be tested. But you are right, I do not know the full denominator for the coronavirus in the state, and it is very possible that it is being spread already, which is why it's so important that we all implement these community mitigation strategies right now.
Can you help us understand, this is my final question on this, how it's different than, we look at the CDC numbers for 2018 for the flu, and 80,000 people in the United States died from that, and I think the numbers I have here are 49 million Americans got the flu, 960,000 were hospitalized from it. So as this denominator grows, right, so the percentage of people that have died from corona is less than what we have now, why are we concluding that this is, as scary as it's being positioned?
So this is new. We're lucky in that we have information about the flu, and also, let's be clear, there's a vaccine for the flu, and there's an antiviral treatment for the flu. And similarly, there are a lot of people with mild cases of the flu that never go into a hospital, they never get tested. That's just how the public health system works. So I think it's important that we take this seriously. You are right, most people who get the disease, it looks like, based on current data, will have mild symptoms, but we still want to take it seriously, and we all want to also remember there are people who are vulnerable. So those who are older, those who have diabetes, those who are on medications, chemotherapy, they are at risk of dying, and that is what we're seeing right now in other countries, so it's something we should take seriously.